mynews.studio.
A virus that used to paralyze hundreds of thousands of children now survives in just 2 countries. How close are we to actually erasing polio for good?
Today's date is 2025, 11/27. Let's start with the numbers. Back in the 1980s, polio would paralyze around 350,000 children each year. Now, according to the latest World Health Organization data, we're down to about 50 cases worldwide. That's a drop of over 99% in just 35 years.
That's one of the most dramatic declines we've seen with any disease. But it isn't zero yet. What's still holding us back?
The last pockets are in Afghanistan and Pakistan. As of mid-September 2025, only 28 cases of wild poliovirus type 1 have been reported, 4 in Afghanistan, 24 in Pakistan. That's actually down from 99 cases the year before. But reaching every child, especially in areas affected by conflict, is still a massive challenge.
Right, it's southern Afghanistan and certain districts in central Pakistan where the virus keeps circulating. Geopolitical instability there makes vaccination campaigns really difficult. But why is it so tough to carry out vaccinations in these regions?
There's a combination of things: ongoing conflict, people's mistrust of health workers, and logistical issues. In some places, vaccinators just can't reach children at all. That's why strategies like hiring female vaccinators, focusing on local workers, and coordinating efforts across borders have become so important. Adds this in as an afterthought, a bit quicker, as if clarifying what's working on the ground.
And then there's the separate issue of vaccine-derived polioviruses. Can you break down what that actually means?
Sure. So the oral polio vaccine uses a weakened form of the virus. In areas where not enough children are immunized, the virus can rarely mutate and end up causing outbreaks. In 2025, there have been 143 cases of these vaccine-derived viruses, mostly type 2, across places like Nigeria, Angola, Ethiopia, Niger, South Sudan, Yemen, Chad, Algeria, and newer outbreaks in Djibouti and Israel. Even some European cities have picked it up in wastewater.
So even as wild polio is disappearing, there's this new challenge running in parallel. What's being done about it?
Newer vaccines, like NOPV2, are being rolled out to lower the risk of these vaccine-derived outbreaks. Also, there's tighter surveillance, testing wastewater, checking communities, so health workers can respond quickly. But the real solution is improving regular immunization coverage everywhere.
The World Health Organization says it wants to certify global eradication by 2027. With all these hurdles, does that seem realistic?
It's a tough goal, but not out of reach. Success depends on steady political and financial support. What we've seen is that when countries and partners work together, progress happens. The challenge is keeping up that focus and funding until the very end.
Is there something we can learn from this for other diseases, like measles, or even whatever the next pandemic might be?
The approach used against polio, strong immunization programs, sharp surveillance, working closely with communities, and global teamwork, is a template for other diseases. But it all comes back to whether we're willing to invest in these systems before a crisis hits, not only after.
And with more people hesitant about vaccines lately, does polio's near eradication help make a better case for vaccination overall?
It's hard to argue with the results. 350,000 cases a year, down to 50, just because of vaccines. But keeping trust high is always going to be a challenge, especially when there's so much misinformation out there.
So it's global teamwork, science, and just sticking with it that got us here. The final stretch may be the hardest, but we already know what works.
Exactly. If we can get rid of polio, it really shows what's possible for other diseases too. But it's not done yet, and that's what matters right now.
From nearly 350,000 children paralyzed each year to almost eradicating polio, just through vaccines, cooperation, and determination. Are we about to see the end of polio in our lifetime?
That's the question. Thanks for joining us as we followed polio's journey and what it means for global health.
Thank you for listening. This episode was brought to you by mynews.studio. You can try it now for free.